When we think about how we can improve the health of adolescents, we often forget to ask the experts, the teens themselves. So a unique research project put the power in their hands. Jakari Pierre has always been interested in research and understanding public health. So in 2018, the Boston Latin student joined 5 other teens to listen and learn.
It was youth focusing on their community and youth, making their voices heard.
With adult facilitators, they developed a youth health assessment survey with questions about mental and sexual health and access to healthy food. They interviewed 93 teens in 6 Boston neighborhoods where people of color make up most of the residents. Their findings, published this month in the journal Health Affairs, are stark.
We found that mental health was definitely something that the people in the community expressed they felt was lacking in terms of resources and treatment.
29% of the respondents said it was not easy to access mental health programs, and major barriers included social stigma and a lack of money. When it came to food security, about half of the participants felt young people had access to healthy, affordable food, and 41% said race played a role. The teen researchers used photos to illustrate their findings, and the caption to this image read, "I was so hungry, I went in thinking they had something I wanted, but they didn't. So I tried walking out, but they stopped me to search my bag."
Young people are very well aware of social factors that influence their health.
Linda Sprague Martinez is the chair of macro practice at the Boston University School of Social Work and an adult facilitator on this research. She says it's critical to include youth voices when making health policy.
Young people experience the world differently than we do as adults, but the way that all of our systems and organizations are set up, they give preference to adults. And if they're not at the table thinking about the solutions, then the solutions aren't going to be relevant.
And to make sure solutions are relevant, Jakari says there is one thing to do.
Don't be afraid to ask us. Don't think that we don't know anything. And really just take our thoughts and voices into consideration.
Pretty impressive young people. This work was all done pre-COVID, but now this group has formed a youth health advisory board, and they plan to focus on Boston Medical Center and its engagement with the South End community.
They are.